Hey, listeners, your host Gabe Howard here. And before we get started, I have a quick confession. I recorded this episode while I was speaking at a mental health conference. I was the keynote speaker and I wanted the show to go on because I didn't want to take a hiatus. Unfortunately, the audio is not up to our usual in studio standards, but trust me, everything else is the insights, the stories, the information. And hey, Dr. Nicole sounds just as strong as ever. So please, I know that you are tuning in to hear insights about replacing your mental health provider. And I just wanted to make sure that you didn't replace me as well.
You're listening to Inside Bipolar, a Healthline Media podcast, where we tackle bipolar disorder using real-world examples and the latest research.
Hey, everybody, and welcome to this episode of the Inside Bipolar podcast. My name is Gabe Howard, and I live with bipolar disorder.
And I'm Dr. Nicole Washington, a board-certified psychiatrist.
And we continue to get your emails. Thank you so much for sending them. Just hit us up at show@psychcentral.com. You can send us topic ideas. You can send us complaints. We really, really love compliments, but you can send whatever you want. That email address is show@psychcentral.com. Dr. Nicole, this topic did come from an email, but it wasn't from a listener. It was from you.
Oh!
And yeah, and it's awkward that we had this exchange because I feel like maybe you read my mind a little bit. The topic, of course, is how to fire your mental health provider, and I have been wanting to talk to you for a little bit. So it's
Oh, Gabe.
awkward but
Oh,
serendipitous.
Gabe. Gabe, are you letting me go? You giving me my walking papers? Are you letting me go?
You know, co-hosting with a doctor is kind of a burden because I can't just say whatever I want. I have to constrain myself to facts. Whenever I grumble and moan, you tell me to reframe. A lot of therapy words are coming up. In all seriousness, though, when you first suggested it, I thought, why is this a topic? But I asked around in the patient community, put out some social media posts, and yeah, a lot of people struggle with how to switch providers or as you so elegantly put it, how to fire your Dr. Nicole.
Yes. You know, I ask patients all the time, how's it going in therapy? And I get answers like, oh, I just quit going. It just didn't work out and I just quit going. And then I'll ask more questions like, okay, what was wrong? Did you talk to them about what was wrong? And it's like, oh, no, I didn't do that. Or I'll have somebody tell me, well, I'm still going, but I don't really know that I'm getting a whole lot out of it. And I just feel so bad about telling them that I don't want to see them anymore. So I just keep showing up. And I think, well, wait a minute. So you're still paying your money every week or two to go talk to somebody, and they probably think, "Oh, I'm doing such a great job with this person. We're really making progress." And you walk away every week going, "Oh god, how do I tell them I don't want to see them again?" I mean, it sounds like a bad dating scenario. It
I
it
was just
it's
going to say that. I was just going to say that. It really sounds like being stuck in a relationship that you don't want to be in.
yeah.
So let's start. Let's rip off the band-aid and go with, is it okay to ghost your therapist? Aren't they just a provider? Can't you just stop going to your Dr. Nicole, your therapist, your mental health provider, and just pick somebody else? I mean, do you owe them an explanation at all?
I mean, okay, so the answer to that is no. You don't owe them an explanation. But I also don't know that just never showing up again is the answer.
So it's a nuance thing. It's absolutely okay to do it, but it's not in your best interest
Yeah, I mean, so
or
it's a
not in your best emotional growth.
I mean, you're a grown up. You can do what you want. If you're paying for a service, and if you decide I no longer want to continue to receive this service, and you say I'm just not going to show up, I mean that happens to us all the time. And it's not like your therapist is laying in bed at night going, I wonder where Gabe is right now. Like, I wonder. I mean, people ghost us all the time. People just stop showing up. They fall out for a number of reasons. People just stop showing up. So I don't know that you're doing something egregious that nobody else has ever done by just not showing up again and moving on. You have that right. You're paying for this service. But is it really the best way?
I'm of two minds, right? On one hand, I'm like, they work for you, right? I don't owe you an explanation. When I use a different carpet cleaning company, I don't call the old carpet and cleaning company and have closure. But then I'm of the second mind. Like, why? Why do I want to get a new Dr. Nicole? Why do I want a new psychiatrist, psychologist, therapist, mental health provider? Because maybe the reason that I'm unhappy is something that I should address with them. Maybe they're pushing me too hard and I would just like them to slow down a little bit. But it sort of smacks to me of this idea that why am I just running? Why am I running from this? Isn't the whole point of mental health treatment to get better and to face your demons head on? And if you can't even face your service provider, you know what's going to happen at 2 a.m. when these thoughts start creeping in our head. So I see real value in quote unquote firing your service provider, or at least raising the topic of getting a new service provider with your mental health service provider. But it also just seems icky. It seems icky.
To just not say anything and never address it and just ghost them, that feels icky.
No, it feels good to ghost them. Ghosting's the easy thing. If it feels icky that I got to have this conversation, right? Like you said, they're not laying awake at night. We're not friends. There's no emotional involvement. This is, ghosting conjures up like dating, and you've got a person who is emotionally vulnerable with you on the other side, not knowing what happened and not having closure.
Yes.
Ghosting a person
Yes.
is bad, but ghosting a business isn't. If you, as longtime listeners of the show know, I go to the same restaurant every morning to get my drink. If I decide to go to a different restaurant, I don't owe them an explanation, and nobody thinks that I do. So I'm struggling to figure out where your mental health service provider fits in between you absolutely owe them an explanation, like people you're dating, your friends,
Right.
or you owe them absolutely no explanation, like a restaurant or a gas station that you frequent.
So I think there are layers to this thing. I think that if you saw a therapist once or twice, you saw your psychiatrist once or twice, and you felt like, you know what, I don't like them. I don't know why. It's just not a good fit. And sometimes it's you just don't even have the words to explain it, but I just don't feel like I'm gonna get very far with this person. And if that's how you truly feel, you probably won't get very far with that person as part of your treatment team. I think there's a difference in ghosting somebody who you've seen like once or twice versus ghosting someone who you've been seeing for a while and then all of a sudden you just quit showing up. Like to me, that's a very different thing. So I guess it's the equivalent of I went on a first date and just never called that person again versus we had 12 dates over the course of 4 months and then all of a sudden I just quit calling them or I quit showing up. Like those are different things. I think the relationship that you have developed with that person matters in the whole do I ghost, do I not? Because, like you said, there's a whole lot of reasons people ghost. Are you ghosting because they're pushing you too hard? Are you ghosting because you know that you're not doing the things that they're asking you to do and you're too embarrassed to show up and tell them that you're not doing the things that they recommended you do? Are you ghosting because you just got busy and your personal life and schedule changed? Are you ghosting because of finances? There's lots of reasons that a person might ghost their therapist or their psychiatrist. I am also in the middle about do you owe them an explanation, but I do feel like your therapist relationship is just different than a random business. It should be anyway, right?
And when you say therapist, just to make sure we're all playing with the same definitions, you also mean your psychiatrist, your psychologist, your
Yes.
therapist. I mean, just
Yes.
just any mental health professional.
Any of those people.
the,
Yes.
the thing that I keep coming back to is, do we treat this like a business, or do we treat this like an emotional connection? I'm really getting hung up because I think both are bad. If you really are looking at your mental health treatment as just a business proposition, I think you're missing out on a lot of places where you need to be vulnerable, where you need to do the emotional work, where you
Yeah.
need to take the inventory, and where you need to have faith in your provider to do the right thing. But at the same time, as you yourself have said, you're not their friends. The,
No.
the, the Dr. Nicoles are not lying awake wondering about you. They've got good hard boundaries, and I think this is what is handcuffing people when they're not sure how to handle this. Because I feel that a lot of people feel that, well, I don't owe them anything. It's not my job to make them a better psychiatrist. It's not my job to make them a better therapist. It's not my job to make them a better psychologist. And there's also another added element here, which is that in order to fire your therapist, provider, etc., and to unpack this, you pay them for the privilege. I've got to pay you to tell you that it's not working out and I'm not happy with your services. That kind of hits. That kind of hits too. I we've gone down so many roads here. I've lost the thread a little. So
Yeah.
just to reshape us a little bit, what is the value to the patient
Hmm.
in having a conversation with their Dr. Nicole
Okay. And not ghosting.
and not ghosting?
Okay.
What is the value to me?
Okay. So there may be a couple things that you benefit from not ghosting. So one, it may actually allow you the chance to practice facing things head on. Not confrontation necessarily, because it shouldn't be confrontational, but it sure can feel that way when you're having to say to somebody, I'm not sure this is working out. And I can guarantee you, most of the time, when a person has a hard time telling their therapist, I'm not sure this is working out, or telling their psychiatrist, I don't know that us working together is really getting me where I want to be. This is not the only relationship in their life that they're struggling with being assertive and stating their piece, and feeling confident, kind of stating what it is that they need. So that's therapeutic. Whether you like it or not, whether it feels good or not, there is value in the ability to do that.
So practice, right? Modeling the way. It's a good opportunity in a safe space to practice being assertive and standing up for yourself. I imagine it's probably also a good way to make sure that you're on the same page, to make sure that the reason that you want to switch providers is a good one. But that's a bit of a sticky wicket as well, because the provider that you're switching from, we want to believe that they're going to act in good faith. Gabe, you're right. I'm not the best provider for you, but there's also a possibility that they're like, oh, I don't know. He takes a hard to fill slot. I mean, he's my 6 a.m. on Wednesdays. Nobody wants 6 a.m. on Wednesdays. I need to build this. I got a tennis court to build in the backyard.
Oh,
That
geez.
big pharma money hasn't shown up in a while. I don't
Oh,
know.
God.
That
Okay.
is where the patient mind goes. Maybe this person is lying to me for profit.
I feel like if that's where the patient's mind goes, that's not going to be a great relationship anyway. You're not going to trust them when they make medication recommendations. You're not going to trust the things that they ask you to do. You're not going to believe them. If you are in a relationship with your psychiatrist or therapist and you always think they're lying to you or trying to hustle you about something, I don't know how much I can help anybody if they think I'm trying to hustle them. Like I really don't. And if I have a patient who thinks I'm trying to hustle them at every turn, and they don't trust what I'm saying, I don't want them to keep seeing me. Like, trust me.
So just to be clear, perhaps if you honestly believe that your provider is ripping you off, you should just ghost them because there's probably nothing to discuss.
I
You're not going to believe them, and they're not going to believe
I
you.
still don't know that I think ghosting is the answer, Gabe. I think that you can just say, "Hey, I'm not gonna reschedule any more appointments after this one. Can you make sure that I have, refills for the next month or 2? I'm gonna change services. I'm going to look for somebody else. I don't feel like this relationship is working." Because at the end of the day, you still need your meds. You can't just say, "Well, I'm gonna ghost them," because a lot of times people tend not to have the foresight to schedule with someone new and have that schedule before they ghost the old person. A lot of times people ghost the old person and then they go months without meds, or they go months without therapy at all, and then they show up to the new person kind of a mess sometimes because they've been untreated for however long it took them to get in with the next person. I mean, the honest to God truth is there is no shortage of people trying to get in to see therapists, to see psychiatrists. Why do you think the waiting lists are 2 months long? So it doesn't matter that your 6 o'clock spot on a Wednesday morning. Nobody's thinking about it in that way. If anything, we're thinking, oh wow, like I wonder what it is that I did, or what did I not do? Or I wonder what I could have done differently. Or I wonder what it is that this person needed that I wasn't able to give them. They may be thinking along those lines and trying to figure that out. But I mean, if you think they're trying to hustle you, then probably you shouldn't be working with them in the first place.
All right, that makes sense. Now you skipped ahead a little bit, but I want to go back to this ghosting thing. I I really see as a patient, one of the benefits is making sure that you're making the right decision. We want to be sure in this decision. Now again, if it's I'm the analogy that I'm thinking of is like being fired, right? We always talk about firing somebody for catastrophic things. They sexually harassed somebody in the workplace, they stole from you, they got violent. It's very black and white. They need fired, and they need fired immediately. No thought has to happen.
Right.
But realistically, when you work in human resources, or when you've had a job for a long time, it's a gray area. It could go either way. Is this a training issue? Do they just need a little more time? Are they going to improve? Should I work with them? You're on the fence.
Okay.
You're not happy with them, but you're not 100% positive that firing them and starting over is the best advice. So I want to talk about that for a little bit.
Sometimes it's I just don't feel like I can be honest with you. I don't feel like I can be as open with you as I need to be for therapy to be successful. You may not even have the ability to say why you feel that way. You just know that you sit in these sessions week in, week out, or every other week, and you just don't feel that connection. And it's hard for you to share and hard for you to open up. And maybe it's just that person, maybe you have some biases you're not aware of, and that person hits on something for you that you're not even consciously aware of. That's okay. I mean, it happens all the time. We all have these things that we carry around with us, and we don't know how other people are going to affect our biases and when they're going to come out. But so back to your employer analogy, this would be also like firing someone because they're not doing the job you want them to do, but then also never giving them the opportunity to do the job correctly, not giving them the information they need to actually do the job. So I never really told you what it is you're doing that I don't like. I just decided I was going to terminate our relationship. And to me, there's just not enough mental health providers out there with availability for you to just randomly ghost somebody without giving them the opportunity to fix it if you genuinely feel a connection with the person. So if you say, I do feel a connection with them, I think they're kind, I feel like talking to them can be very helpful. I just don't feel like I'm getting what I need, so I'm just gonna ghost them. Like that doesn't feel right. You didn't even give them a chance to say, well, this is what I really need out of therapy. This is what I really want out of therapy. You didn't even give them an opportunity. You just said, I'm just not going back because it's too hard. And I just don't feel like doing hard stuff. But life is hard. Working on your mental health is hard. So ghosting doesn't feel like the right thing in that situation for sure.
One of the things that's jumping to mind is I remember a time when I was seeing a therapist, and I was new. I was newly diagnosed. So this is just in the first couple of years. I wasn't a mental health advocate. And I just made the offhand comment in therapy, I don't feel like I'm getting any better. I don't feel like I'm improving at all. And my therapist immediately jumped into, let's do mood tracking. Let's do a mood journal. Let's start setting goals. Let's start setting benchmarks. And this did wonders, and it was just an off the cuff comment that I made that she picked up on. Now I think about Gabe all these years later, right? I've been managing bipolar disorder for a long time. I'm more jaded now. When I feel stagnant in therapy, I think, oh, it's time to move on, it's time to fire that person, it's time to ghost that person, it's time to get a new therapist, it's time to go in a different direction. Just because of the way my brain is conceptualizing that stagnation. So I have to remind myself to slow down. This might not be them. This might be the situation. This might be me. This might be any number of things. And the best place to work that out is with my doctor, Nicole, my therapist, my psychiatrist, etc., and have what is a tough conversation. Hey, I don't feel like I'm getting any better, and I'm wondering if maybe I need to move on,
Right.
and then see what tricks your Dr. Nicole has up their sleeves.
So when you did mood tracking, did you see that you maybe were getting a little bit better than you gave yourself credit for? Was that the end result of tracking, or was the tracking more so helpful because it helped your therapist then see where you were still struggling?
In my particular case, it showed that I felt that I wasn't getting better. But it showed that I felt that I was sort of neutral. Right. So it was sort of a twofold thing for me. One, I described everything as catastrophic. This is the sickest I've ever been. Using that 5 point scale, I realized, okay, no, you're more towards the middle. You're not thriving. You're not where you want to be,
Right.
but you're also not as sick as you say you are. So there was
Right.
that. But also, she realized that I was really good at masking. I was really good at hiding. I was really good at pretending to be something I'm not in order to get by, which opened up a whole new avenue of therapy.
Yeah.
And again, this all ties back to what could arguably be me thinking, yeah, maybe I need to fire this lady. Uh,
Right.
thank God I didn't just ghost her, or I never would have gotten there.
Exactly. So ghosting, you would have missed out on the opportunity to have a mental health professional who obviously cared and was competent to be able to help you identify what you were doing and to then work through that, and you would have missed that entire opportunity had you just ghosted this person and not said anything.
And we're back discussing switching mental health service providers. I completely agree. I do want to get back to the jaded part, right? Because trying medications can be overwhelming. Working on your demons and your vulnerabilities and dealing with your emotions and your past can be overwhelming. And I wonder how often we think, I just want to get away from this person, when in actuality, what we want is a small reprieve or a small break from the hard work that we're putting in. Especially dealing with past traumas and the side effects of medications, especially after maybe one goes poorly, and hits you with all kinds of side effects. And they're like, "Oh, we'll take you on this one and put you on this one," and you're feeling like a guinea pig, and you're thinking, "Man, I just like to take a beat. I just like to take a break." I think that's really healthy, and maybe instead of going with firing, call up your doctor Nicole, call up your therapist or your provider to say, "Look, I need a couple of weeks to regroup, and can I get on your schedule in a month?" And then you've got a month lead time. And then they know what you're doing too. They know that they've been pushing you too far and that you're overwhelmed. So you are keeping those lines of communication opened.
Yeah, I mean, I have patients tell me all the time. Let's say we try different medications and they have side effects to back changes. I have had people say, I don't know, Dr. Nicole, if emotionally I can handle taking another new med and having to deal with side effects. Can we back off for a little bit? Like, can we stop making changes for now? Can we just keep me on this for now? Can we go back to that thing that maybe didn't work quite as well, but worked a little bit, but I didn't have side effects to? Like, can I just go back to that place for a little bit? I don't know that I can handle another new med, new side effects. I don't know that I can do that right now. I need a break. And we absolutely do that all the time. I do that all the time with folks when they say I need to step back because I don't, again, think the answer is ghosting and walking away if we're talking meds and we're talking no meds versus let's come up with a plan of something we can do that feels more tolerable to me. And so I think meds is a little bit different story. And I would encourage you not to just say, well, I'm just not going to do any meds for like a month and let me just regroup and come back. We really have to think about that as a potentially dangerous option for you, especially if you unmedicated before was severely manic or severely depressed. I think we have to have that conversation before we talk about what taking a beat looks like and stepping back and reconsidering. So I think it's a very individualized conversation that needs to happen. And it's one that I have frequently with people, especially when we're making lots of changes and they're struggling with all the changes that we're making.
One of the themes I've noticed is communication. It's open and honest communication. Firing somebody, ghosting somebody, not talking about what's bothering you. It really does seem to rest on this idea that you are not being transparent with your provider. And we know that in mental health care, if you're not being transparent, you're not getting the best care, because you can't run a test. You can't take a urine sample, blood work, pull my hair, run a CAT scan, and figure out what's going on with me. You only know what I tell you. And if I don't tell you that I'm thinking about firing you, if I don't tell you that I'm uncomfortable, that is data that you do not have to make recommendations to me.
Right.
So I'm really starting to get the feeling that discussing this desire to fire the person benefits me the most, because I'm the one who has the most to lose.
Yeah, you absolutely have the most to lose, which is why I think it's worth really exploring with yourself and probably with the person you're thinking about firing. Is this the best move to make? Any therapist worth anything, any psychiatrist worth anything, anybody who's providing you with a service worth anything should want you to get what you need. I want every patient I see to get what they need, whether I can give it to them or not. I don't want them to think, well, bad therapy is better than nothing. So let me just stick with Dr. Nicole because at least she's consistent. I don't want that for us. I don't think that's helpful. I don't think that's valuable. I don't think having a bad psychiatrist is better than having none at all. I don't know that that is the answer either. So I do think the exploration is it's important, which requires some communication.
Yes. Yes. And if you have determined that it's ineffective, bring that up to your therapist and maybe they will agree. This is Gabe has stories. I have a whole podcast. One time I said to my therapist, I forget what statement I actually made. I really don't remember. But my therapist said, I've been meaning to talk to you about this for a couple of weeks, and this has just solidified it. You need to move on. You need to find another therapist. And I want to recommend somebody in the practice to you who I think would be a better fit. And this was my first therapist, so I immediately said, well, what did I do wrong? Why? And she goes, nothing. You didn't do anything wrong. She goes, when you came to me, you're very vulnerable. You needed, she called herself a huggy therapist.
Supportive, super
Yes.
supportive. Yes, super
Very
supportive.
supportive, gave me a hug at the end of every single therapy session, right? She is I needed to be wrapped in a cloud
Yeah,
and handled with kid gloves.
yeah.
And now here we are 2.5 years later. And she's like, frankly, you need somebody that's gonna call you out on your shit. And she used those exact words. It's the harshest she'd ever been with me. She dropped a little bit of the supportiveness or hugginess. She's like, you need somebody who's going to call you out on your shit. And she recommended me to another guy who was night and day different. I mean, he was so mean. He was so mean. Uh, but she's right.
Right.
That's what I needed. I needed somebody to shove me. I'm not even saying push, shove me outside of my comfort zone. And she realized that. So if I had decided on my own, hey, she's too supportive, she's too huggy, she's too namby-pamby, she's too caring, I'm not getting any better, I don't need therapy anymore, I never would have gotten to the next level, which was, hey, let's build your skills outside your comfort zone. Uh, to use an analogy, right? She was great for weight loss, but he was muscle training. And it was time to move on in my fitness journey to muscle training. And she was all cardio all the time. She wasn't about getting the six pack at all. And I was really, really glad that we had the conversation. I know that I did not start that conversation. She started it. But to empower patients, if you feel that you're in that spot, maybe you need to broach it.
Yeah.
Self advocacy is super important.
But it was based on something you said. It was something
It
you
was.
said that made her say, "Hmm," and pick up on the fact that this was no longer an effective relationship for you and that therapy was no longer effective. But you're right. A lot of times you have to be the one to say it because I won't know. I mean, people complain. You would be surprised the things that people fuss about or complain about that they never said, and I would have no way of knowing that something bothered them that I said or did because they never miss a beat. They keep smiling, they keep on with the conversation, we make it through, and then maybe at the end, after on they'll tell somebody, "Well, she said blah blah blah, and I didn't like that, and so I'm never coming back." I had no idea. Like I would have no idea. I could walk away thinking, "Wow, that was a great session. That person seems like they're getting better. All is well," and I could be dead wrong. So a lot of times you have to be the one to say, "Hey, I don't think this is working," or "I don't like this particular thing." But make it something realistic and reasonable, not just you trying to get out of therapy. I mean, people say all kinds of things. I mean, I had somebody say they weren't going to see me anymore because I drank coffee during the visit. They thought it was disrespectful that I drank beverages during the visit.
Well, now hang on. What kind of coffee? Because if it's bad coffee, if you're going getting gas station coffee, then
It
yeah,
doesn't
I'm
matter.
out.
Doesn't
I'm out.
matter. It's my
And as you
coffee.
know, my love of Diet Coke, if you were drinking Pepsi during my psychiatric appointment, I'd be like, I can't trust her to put things in my body when she's putting Pepsi in hers. I love this part of the podcast right now because there are lawyers that are like, uh-oh, they're getting sued. No, I completely understand what you mean. Dr. Nicole, I know that we're almost out of time, but the third thing we absolutely promise that we want to cover is, okay, what is the best way to broach this subject? We have peppered in a lot of ideas. We've, of course, discussed ghosting versus not ghosting. We've discussed that open communication and transparency is paramount. But I want to, wrap this up in a nice little bow. And my question as a patient is, are there any questions that I can ask you? Are there any expectations that I can ask of you? Is there any data that I can request from you to let me know if this is going well? Are there any words that patients are often unaware of, or any questions that patients are often unaware of asking that we should be asking our mental health professionals to make sure that we're getting good care and to help inform our decisions?
To make sure we're getting effective care, I I do think it starts day 1. It starts at your first visit. If you've had bad experiences with previous therapists, or you're one of those people who's like, therapy just doesn't usually work for me. I'm gonna give it another try, I guess. If you're going into a new therapeutic relationship with that history, I think from day 1, you need to be able to tell that person, why did therapy not work out for you before? Like, specifically, what did I not like about therapy before? What did I not like? What did I not like that the therapist did? It is helpful for you to come into this new relationship knowing what went wrong before. That is extremely helpful. It's also helpful for you to know what you want to get out of therapy. People just show up. People just show up to therapy and they're like, "I just wanna get better." What in the heck does that mean? Like, what specific identifiable goals can you identify that you really wanna work on, in therapy? What are they? What do you want? Do I want to be more assertive with fill in the blank? Do I want to be able to set better boundaries with a specific person? Like, what is it that you want? Because that will also help guide us. I also think it's helpful in the beginning of your relationship with a new therapist to say, is it okay if we check in like every 3 months and just do a check-in on how we both feel I'm progressing? Like a little report card, a little evaluation, a little check-in. Can we do that? I think those are extremely helpful things to have in place. When it comes to your psychiatrist, your goals are usually, I want my voices to be quieter. I want them to be gone. I want to have a more stable mood. I want to have a decrease in severity of my depression episodes. I want to sleep better. I want to have good mood, but I also want to have an intact sex life. Like, whatever your goals are, I think you need to have them defined and know what they are so that person knows if you're hitting them. Are we getting to that point? I think therapy will never be effective or successful for you if we have no idea what our goals of treatment are.
So, Dr. Nicole, let's talk specifics. When is the best time to bring this up? Is this the first thing that you should say when you sit down? Is there a strategy? Should you wait until the appointment is over and your Dr. Nicole is like, okay, well, when would you like another appointment? And be like, boom, I'm thinking about firing you. What's the I know that it's not one size fits all, but
No, no.
what's the best strategy here?
Nobody likes to get hit by what I affectionately call the BT dubs on your way out the door when you say, "Oh, by the way, I'm not sure I want to reschedule again." Don't let us have spent 45 minutes together and then you wait in the last 3 minutes to say, "Oh, I don't think I'm going to reschedule because I don't think this is working out." That Don't do that. That's not okay. Don't do that. Bring it up in the beginning. Say, "Hey, I want to today talk about therapy and how it's going." Give us the time to talk about it because it may require a lengthy conversation that you know full well will not happen in the last 3 minutes of your session, which I suspect is what you're hoping for by waiting until the very end to bring it up because you don't want to have the conversation. So, do not do it at the end. Do it at the beginning. Timing is important. Timing is key.
Now, I know that some patients are worried about starting this conversation. It's a scary conversation to them. And one of the strategies that I've always recommended is send an email. Put it in your my chart. Just say, hey, I've got an appointment coming up, and I would like to discuss the following things.
Right.
I just wanted to give you a heads up. If you're really super worried about it and you don't have those things, leave them a voicemail. Call at 3 a.m. and leave a voicemail, and just say, hey, I've got an appointment coming up in a couple of days, and I want to talk about this. And last but certainly not least, you can always write it down and read the letter just to make sure that you get all of your thoughts out. You can write it down ahead of time, hand your Dr. Nicole, your therapist, et cetera, the letter, or read it out loud. Now, as a patient, really feel strongly that these are good ideas, but I'd like to hear from you, Dr. Nicole. As a provider, would you respond well to those methods?
Yeah, I mean, it forces me to talk about it. It takes some of the heat off of you in some ways. If you say, "Hey, I really want to make sure we talk about, our therapy and how it's going," then I'm going to bring it up first thing. So it doesn't force you to be the one to bring it up, and sometimes that feels better. As long as the conversation is held, that's fine. And things are typically a little bit different for me, as a psychiatrist. If you wait till the end of my session to say, "Oh, I don't want to come see you again, but I've only put in a month's worth of refills because I need to see you again in a month," then that's going to create quite a conundrum for both of us, because you're going to feel like, well, I just need you to give me several months while I go look for somebody new. And I'm going to say, no, that's not how this works. So it is a little bit different when you're talking therapist versus psychiatrist. What is the issue? What are the underlying issues leading to this? And how do we realistically make this happen going forward?
All right, Dr. Nicole, just to make sure that we cover all the bases, now the decision has been made. There's no more
Okay,
nuance, there's no more gray, there's no more discussion. We are switching providers. We're getting rid of Dr. Nicole and we're going with Dr. Gary.
go
The
for it.
decision has been made,
Okay.
right? What is the best way to do this as far as from just a task assignment? What is the process? How does this work? What do I need to know?
My recommendation is for you to schedule with someone. Get on someone's schedule and then decide your timeline from there. So if you know you're going to see a new psychiatrist and the psychiatrist that you want to see, Dr. Gary, has a 2-month waiting list, then you need to get that appointment with Dr. Gary ASAP. And then you need to have a conversation with me and say, okay, at this point, I have an appointment with a new psychiatrist at this date. I would recommend you ask for your records to be sent to the new psychiatrist so you can fill out a release of information form and do that in enough time so that Dr. Gary can get my records so he knows what we talked about or what we've done and what meds you're taking. And so when you show up, it may take some of the guesswork out of what have you been doing for the past however long with Dr. Nicole. That is extremely helpful for a new person to have that information. So I would just say, I have an appointment with Dr. Gary on this date. How do you want to handle prescriptions going forward? I think I need a change. I just feel like this isn't a good fit for me. And I think most people are going to say, okay, well, I wish you the best, and let's make sure we don't have any, lapse in coverage, and move on. Now, for a therapist, I would recommend you say, I have an appointment with a new therapist on this date. Can you send my last progress note? Can you send, can you send something to them? Therapy, you may or may not get that. You may not need it. You may feel very comfortable just going in and saying, well, this is, what we've been working on. This is what we've talked about. But for psychiatry, absolutely, I think it's helpful to have records, because a lot of times you come in and you're like, I don't know what meds I've tried. They all sound the same. I don't know. I think I took this, or maybe it was my mom who took that. I don't remember. You go through all this. It's nice to have those specific details available to the new person. So I would say, get records submitted, make the transition as smooth as possible, and just be pretty matter of fact about it. I mean, it happens every day.
Also, a little pro tip, make sure that you sign the medical release waivers, because it doesn't matter if it's Dr. Gary or you personally requesting those medical records. I happen to know for a fact that without that signature, they're not releasing nothing.
Not a doggone thing.
All right, everybody. Thank you so much for tuning in this week. We hope we have given you a lot to think about, and we need some favors from you. Wherever you downloaded this podcast, please follow or subscribe, because you don't want to miss a thing. And tell everybody you know. Post your favorite episodes on social media. Send somebody a text message. Send somebody an email. Bring it up in a support group. Wherever there are people living with and managing bipolar disorder, tell them about the Inside Bipolar podcast, because sharing the show is how we're going to grow. All right, my name is Gabe Howard, and I am an award-winning public speaker, and I'm probably available for your next event, and I'd love to come and see you. I also wrote a book. It's called Mental Illness is an Asshole and Other Observations. You can get it on Amazon, but you don't want to get it there. You want to head over to my website, gabehoward.com, and get a signed copy with some free swag. You can also follow me on social media, Instagram and TikTok, at Ask a Bipolar.
And I'm Dr. Nicole Washington. You can find me on all social media platforms at Dr. Nicole Psych, or on my website at drnicolepsych.com.
And we will see everybody next time on Inside Bipolar.
You've been listening to Inside Bipolar from Healthline Media and PsychCentral.com. Have feedback for the show? Email us at show@psychcentral.com. Previous episodes can be found at psychcentral.com/IBP or on your favorite podcast player. Thank you for listening.